Good afternoon, everyone. Thank you for joining us and welcome to the third installment of the Economic Recovery and Revitalization Town Hall. We are happy to have you here today. We have a lot of good guests with us, as well as some important topics to discuss. As usual, we are fortunate to have Dr. Gales and Dr. Stoddard here providing public health information as well as safety information for us as we go through the pandemic. We're also joined today by Ashley Duckman, who is with the Maryland Chamber of Commerce. A few things before we get started. We did receive a few questions in advance. If you do have questions, please feel free to put them in the chat as we go through our conversation. Once we get through all of our panelists, we will start our Q&A. We'll start with the ones we received in advance, and then we will go to the ones that we received today. So please make sure that let us know if you have something you would like to say or something to clarify from what is said that you heard today. I do want to put out a few reminders. One, people are using the tent program very well throughout Montgomery County. We want to encourage you to make sure that as your businesses use the outdoor tent for outdoor dining, that you continue to follow the rules, make sure that you wear your mask and do still provide social distance opportunities. We want to make sure that we follow these rules. Just because they're outdoors doesn't mean they're different than what is indoors. We want to make sure that we continue to be safe in everything that we do. I also want to remind everyone that there are several opportunities still out there available for funding as it relates to business relief that we are trying to get out the door. That seems to be the effort of the month, is making sure that the federal funds that we have received are used properly and distributed accordingly. So whether it's the state funding that we got, the EDC is distributing to our restaurants, whether it is the tourism anchor institution grant, please make sure if you qualify that you are applying for these grants. This is money that we definitely want to put in the hands of those who need it. The Reopening Montgomery grant program closed, I believe it was yesterday. So that one is in its final stages. We are ramping up by pulling all of the remaining applicants so that we can ensure that we get through those and get that money out by the door by the end of December as well. So again, I want to thank you all for coming. I'm going to now turn it over to Dr. Gales, who is going to give us a report on vaccines. Oh.
All right, let's take two. Good afternoon and happy Friday, everybody. It's been a long week, so forgive me for the mute. Before talking about vaccines, I do just want to give some brief updates in terms of where we stand in case numbers. In case you haven't noticed, we did receive notice today that we have broken the record for cases reported for the state as well as the county. This is what we were concerned about post-holiday travel. We are reported for the state just shy of 3,800 cases today. It was 3,792. And for Montgomery County, we reported 631. Just as point of reference, our previous high in the county was somewhere in the mid 500s, I think 540, which was back in May. And we did have a day last week, or early this week, I'm sorry, of 505 cases. The previous high for the state was approximately 2,900 cases, which was reported about a week and a half ago. So that's where we stand. We will continue to follow the numbers, and we are unfortunately seeing a correlation to increases in hospitalizations, secondary to these increases in cases. So we're continuing to work with our hospital partners, and we're also continuing to work with our other jurisdictions across the state to discuss if and what other steps we need to take to mitigate further transmission, because the numbers are quite concerning. And based upon the trend lines, I would suspect that they're going to get worse before they get better. Now, I don't want to always start every conversation with bad news. That's unfortunately the reality of where we stand right now. But there is some promising news on the horizon, particularly as it relates to the presence of a vaccine or vaccines. Now, some of you who follow along at home may have seen recently that there are two vaccine candidates, one being manufactured by Pfizer and another one being manufactured by Moderna, that have completed their phase 3 clinical trials. And it's important to to talk just a second about what that means. So what's a phase 3 clinical trial? So typically, medications and vaccines go through a 4-phase set of trials to get approval. The third phase is most significant because it's when they test the medicine or vaccine on a large pool of folks and a diverse set of folks. And each of those candidates that have completed the phase 3 trials tested somewhere in the range of 40,000 individuals over a significant time period. And what they found is in each of those cases that they were predicted to be 95% effective in terms of preventing the development of COVID illness. Now, what that means is, for example, in the Pfizer study, they tested approximately 41,000 folks. Half of those folks were in the placebo group. The placebo means they got just a dummy, it wasn't the real vaccine, they got something else. And the other half actually got the vaccine candidate. And in looking at those numbers, they found that for the individuals in the placebo group, there were over 160 folks who developed COVID, while only 8 individuals in the vaccine group developed symptoms. And based upon how we calculate those numbers, that shows that it is 95% effective, and comparable numbers were seen in the Moderna trial. So each of these companies have filed for emergency use authorization platforms. Pfizer did so last week. Moderna did so this week. Pfizer's hearing will be on December 10th of next week. During that time, it will be decided by folks at the federal level if, based upon the data that has been submitted, it will be determined if it is safe to move forward in producing that particular vaccine large scale and administering to people. The EUA hearing for Moderna will happen on December 17th. Now, what that means is if they are approved, particularly if Pfizer's is approved on the 10th, that vaccine could be available for distribution and dissemination as early as December 14th to the 18th, somewhere during that time period. Now, that does not mean that everybody's going to have access to the vaccine right away. What it means is that the first doses will be able to be distributed across the country and shared with the first set of priority group participants. Now, as a point of reference, I would point you to the National Academy of Medicine study that laid out the different priority groups. There's 4 sets of priority groups, the 4th being the general public. Within the first group, there's 2 sections. There's a 1A group and a 1B group. The 1A group has been confirmed that will include healthcare workers and residents and staff of long-term healthcare facilities, including nursing homes and other types of assisted living venues. Now, the way that will be distributed is, again, it won't be open. We've got large-scale distribution sites across the county. That is to come. But initially, it will be disseminated directly to the hospitals and directly to those long-term healthcare facilities. Each of the candidates, both the Pfizer vaccine as well as the Moderna vaccine, will require 2 doses to be given approximately 1 month apart. And as we continue to move forward from the early initiation stages of those priority groups, other groups will be brought online. Now, the expectation is that once we get to the second phase or the second priority groups of folks, and again, I would encourage you to reference the NAM report that lays this out, then the vaccine, will start to become available to private providers so that folks who fit those categories would be able to go to their private healthcare provider and get the vaccine, as well as utilize a number of other platforms. And that is where you're likely to see county-led efforts pop up where people can get access to the vaccine as well. The time period within which this will happen before it gets to the general public is probably somewhere in the range of 4 to 6 months. During that time period, we're going to continue to encourage, require, and recommend that folks adhere to the same public health guidance that we have in place now, which is wearing face coverings and physical distancing and those types of practices. because ultimately it's going to take that long to get the adequate production up to be able to get as many people covered and as open to the general public for additional coverage as possible. The expectation is that it is likely that there will be other vaccine candidates that will come online as well during that process as we roll out after the first two. I do also want to caution in terms of expectations of the volume of vaccines that will be available. First, the first wave, even if approved on December 10th, the first batch of Pfizer vaccines will be approximately 6 million vaccines to be distributed across the country. That comes out to roughly approximately 55,000 doses delivered to the state of Maryland. So as you can imagine, we've got a lot more people than 55,000 in the state, and even within the healthcare worker field, as well as residents in our long-term care facilities. So this process will be done over a series of time, and it won't be instant, and it won't be large scale, at least initially. It will be ramped up, and again, as more come online, we can get more people vaccinated, more people covered. And one of the benefits, well, there's big benefits from this, but the first one obviously is we can get people protected from the vaccine, or with the vaccine, and protected from developing COVID. And that by also being able to protect our most vulnerable residents of society, that gives us a little bit more confidence level in terms of being able to open things back up comfortably within our society, particularly as we drive the numbers back down from where we are right now. So that is a very condensed 30,000-foot view of vaccine dissemination and distribution. Trust me, it's a lot more complicated than that, but those are the big take-home points. We're continuing to work on a local level with our partners across the region and with the state as well on those dissemination plans and strategies. We will continue to make those public as they come online. And in the meantime, we also are encouraging folks to read factual information. It's hard to do in this day and age of social media, but read factual information that provides true answers to a lot of the questions that folks may have. And as we get access to a lot of those questions, we're working to pump that information out and provide that to the general public as well, because ultimately we would like to see a large percentage of our population and residents get the vaccine to ensure as great a protection level as possible. I will stop there and turn the floor over to Dr. Stoddard, and happy to answer any questions at the completion of the presentations. Thank you.
Thank you, Dr. Gales. As Dr. Gales said, I'm Dr. Earl Stoddard. I'm the director of the county's Office of Emergency Management and Homeland Security. Just a few things I want to talk about today. Everything Dr. Gales said, obviously I've been working on as well, and we've been working on together, focused on hospitals and making sure that we have surge capacity. Making sure that we are responding to issues in our congregate living facilities. Had the unfortunate added complexity this past weekend of the fire at Leisure World, where we had to identify places for those displaced residents in the middle of a pandemic, which is obviously challenging. One area I do want to talk about as it relates to the business community is we have ramped up our enforcement. This actually coincides exactly with the governor's suggestion that the Maryland State Police and local police be interfacing with the public health and other agencies doing enforcement. We have added to our enforcement cadre, both enforcement and education. I think it's important that both of those be paired together. We originally had our health and human services and alcohol beverage services operating together, doing most of the enforcement and education. We've since added on our Department of Transportation, Environmental Protection, Housing and Community Affairs, Animal Services, and Transportation, I think, to the efforts. We had a number of teams out, both the Wednesday before Thanksgiving and the weekend following Thanksgiving, and visited more than 100 different businesses, whether those be restaurants, retail, or other businesses. And frankly, we issued no citations. So that's, there's two things there. Number one, I think the businesses that we visited generally have done a very good job of implementing and enforcing the public health measures, both within the governor's executive order and within the county's executive order. The flip side of that challenge is that our contact tracing still has not shifted and still shows the same relative locations that people visit when they come down positive with COVID, which is that they're there are a whole host of activities that they do, but there's, working outside the house is still a huge concern, as are, connections to retail, dining, and all the things that we've talked about before. And so we're left with this challenge of saying, we're not seeing huge violations in our enforcement side, but at the same time, we are seeing huge increases in our cases, and no big shift in the distribution of those cases, and where they've gone in contact tracing, meaning there's no smoking gun of a location that says, oh, this is the problem, let's go target enforcement here, or let's go shut that particular thing down, because it's sort of across the board. And so we're left with the same things that we've said before, which is that locations where people gather in large numbers, particularly places where they cannot have consistent face covering wearing, are the places that give us the most concern, and frankly have been often reflected the highest in our contact tracing. And so that includes, obviously we're talking about businesses. That's largely what we're focused on in this call, but we're doing similar enforcement on private property where there are gatherings that may be of particular concern as well. So I will stop there, and I do want to welcome our special guest, Ms. Duckman she's the Vice President of the Maryland Chamber of Commerce. So, Ashley.
Sure. Thank you. Thank you, Dr. Stoddard and Dr. Gales and Jerome, for inviting us to participate today. Appreciate the opportunity to bring this group up to speed on what the State Chamber is working on with respect to 3 key areas and issues that I know are going to be important for all the folks on this call. I did want to first acknowledge that Montgomery County Chamber of Commerce and all the local chambers of commerce in Montgomery County are really the tip of the spear for our business community in your jurisdiction, and we very much always appreciate the hard work that they're doing on behalf of their members, and we work very closely together and in partnership, and so just acknowledge and appreciate their hard work, and didn't want to go by without acknowledging that. So I'm going to focus on 3 key areas. The first is business relief, which I know you've already spent a little bit of time talking about, Jerome, and then also 2 other issues that have come up for us that we're very focused on, addressing what is going to be a cliff as we come to 2021 with the area of unemployment insurance, and then also business liability protection. So those are going to be the 3 key areas that I'm going to touch on today. So as it relates to business relief broadly, I know that for most of you, it probably doesn't feel like this during your day-to-day, so I hate even saying it, but really at an aggregate level, we are in a far better place from an economic perspective than we were in the spring. But if we look across all of our key economic indicators statewide, though it is true that we're faring better than many states across the country, which, as you all know, is in large part thanks to our federal government economy and being close to the district, we are nowhere close to over the proverbial economic hump on this. And though there is seemingly movement in Congress right now, potentially on a 4th stimulus package, in the absence of that happening and taking place before the end of the year, we're really leaning on our state policymakers. They must step in. And so any action taken in the next couple of weeks, and in particular during our next legislative session, are going to dictate how quickly and strongly our business community in the state is going to be able to recover from the pandemic. And really the bottom line, and you know this, businesses continue to struggle, and many of the segments represented on this call are among the hardest hit, continuing to operate at limited capacity. Many of our small businesses, which, as you all also know, make up more than 90% of our total business population here in Maryland, continue to need support, whether that's financially, operationally, or otherwise, through things like loans, grants, incentives, et cetera. We are very aware that though there has been tremendous strides made in this space with financial and other support, there's a lot more that could be done, needs to be done, and really, will it ever be enough is the question. But really, any effort we can make to support our small businesses in particular is something that we're aggressively pursuing. The one thing that we have said that is consistent is uncertainty. Every prediction, every projection is a moving target. And so we're just doing our best to ride the wave and take this day to day. We know that our businesses are resilient, flexible, adaptable. And when we as a business community are given the rules of the road, I think we have proven that we can rise to the occasion, adapt in the face of uncertainty. So let's now dig into what we mean when we say business relief. At the Chamber, when we are talking about business relief, we look at it in two categories. One is direct financial assistance to business owners. Think these programs that Jerome mentioned, loans, grants, other incentives. And we are looking for, trying to identify any areas where we can find that financial assistance, whether that's through congressional action, state action, remaining CARES funds, unspent general fund revenue, whatever it may be. We're looking for those dollars constantly and trying to figure out how we can steer them to support our business community. The other category when I talk about business relief is one that I characterize as do no harm. And that is we are watching to ensure that there are no new regulations or new revenue raisers or taxes on businesses when they can least afford it. So in those two categories, we are diligently focused on making sure that we are trying to support our smallest businesses, both through one, direct financial assistance, and then also do no harm. But we also acknowledge that the state itself finds, it is in a precarious financial and budget situation. If you look at the projections, and we'll get more later this month, hopefully, we're talking about at a state level, something like a deficit of potentially $2.5 billion come FY 2022 that the governor and the General Assembly are going to have to figure out how to close that delta. And so we're mindful of that, but our members across the board are very concerned that the solution to that challenge is going to be tax increases potentially on the backs of businesses at a time when they can least afford it. So that's what I mean when I say do no harm. That would be exceptionally troubling. The fact that it's even being batted around at this stage, given the uncertainty in our economy and our unemployment numbers that we continue to see rise. As it relates to business relief in the form of incentives, we are talking with members of the General Assembly, recognizing that the revenue picture is not great. There may still be an appetite for some new incentives. I know, for example, there's an idea being batted around with some members of the Senate to provide a tax incentive for businesses that put in new air filtration systems. That's just one example. There are a lot of ideas like that floating around, and we are tracking them and supporting them wherever we can. If as a business owner, you have an idea or something that you think would be exceptionally helpful on that front, please reach out to us. Let us know. We're collecting them, and we're trying to figure out the best path forward for trying to move some of those incentives that make sense. So on the business relief front, I would just conclude that portion by saying the best thing we can do right now for our business community is provide as much predictability and stability as possible. That means finding money where we can and not making dramatic changes to taxes, tax structures, regulatory requirements, et cetera. And like I said, where and when possible, providing that financial relief and making sure it gets there quickly. Quickly, just cruising through, I told Jerome if I got paid per dollar per word, I'd be living on an island right now. So I'll try to cruise through the rest of this pretty quickly. I know that unemployment insurance is a concern for this group. It's a major issue that we've been following since day one of the pandemic. As individual claimants continue to draw from the fund over time, of course, that means that our fund diminishes, right? And that fund has to be kept solvent over time. How is it going to be paid back? Well, in the absence of state and local funding from Congress or intervention from our own state government in some other way, or a glitter money tree that rains money into the fund like magic, it's going to have to be paid back in the form of higher premiums for employers come 2021. Just to give you some context, our own state, Maryland Department of Legislative Services released a report, their issue papers actually, earlier this week, and just this is context it's troubling, and I hate to even say it, but it's the truth. And this is a hypothetical situation. If in fact Maryland moves from Table A in the unemployment insurance premium category from Table A in 2020 to Table F in 2021, an employer that has no claims history, meaning they've laid no one off for the last 3 years, will see an increase in state unemployment insurance taxes from about $25.50 per employee in 2020 to what could be up to $187 per employee in 2021. That's a more than 7-fold increase. in a cost per employee if we do nothing and we leave things status quo. There's another issue here, which is that that's for an employer who has no claims history. If you're an employer who has had to lay people off, you've had a negative impact to your experience rating, for example, that same employer, even if we're talking about just one modest claim in the time period from March to April 2020, your taxes could increase up to $263.50 per employee. So we're talking about some really big numbers. These are hypothetical examples, of course, but big numbers for employers at the time when they can least afford it. So we're working on addressing this issue in two ways. The first is that we have to figure out what we're going to do about the balance of the fund. We, like the governor, like the administration, have been urging Congress to pass a fourth stimulus that includes state and local funding, some of which could be steered toward our unemployment insurance trust fund to offset that impact. Even if we couldn't, we're never going to stay in table A, which is our best case scenario. It's not going to happen. We're realistic. If we could say make our position better by moving from table F to table E or D, that would be something that I think our business community would welcome. So that's one area. We're talking to members of the General Assembly about other ways we could spread out that impact or offset that impact in a meaningful way. The other issue, like I kind of touched on, is the experience rating. And you as employers know that if you have to lay off an employee, you receive an experience rating notice, which indicates that one of your former employees has drawn from the unemployment insurance trust fund. And that is factored into your calculation when your tax rate is projected for the following year. As you all know, as small business owners, some of you had to lay employees off because you shut your doors because you were complying with the governor's executive orders. And we feel strongly that an employer's experience rating should not be impacted if they had to lay off employees as a direct result of the pandemic because they had to close their doors to comply with the governor's mandate. And so we're working, we believe, we've talked to the administration about this ad nauseum. We believe that we have to fix that in statute through legislation. And so we are working on a bill that will be put forward this upcoming legislative session to try to address that issue. But we know that unemployment insurance tax rates for 2021 are of extreme concern, and we're working on it every day. And the last issue, and then I promise Jerome I'll be quiet, is liability protection for business owners. Businesses of all types and sizes, and not just businesses, educational institutions, nonprofit organizations, all are working to protect employees, customers, students, everyone from this public health, from the pandemic. I mean, everyone, public health and safety across the board for my membership, and I know for all of you, is #1 priority. But one major fear that in particular our small business owners have had over time is that there is grave concern that small business owners that follow COVID-19 health and safety guidelines still fear that they are going to feel a financial impact from what they would characterize as meritless COVID-19 related lawsuits. There are a number of studies done about it, surveys of small business owners. It remains a very real fear and concern. And as we feel that as the private sector contributes to COVID-19 response, it clearly faces liability challenges that our governments do not. So this is something that's been talked about a lot at the federal level. We hope that there will be some business business liability protection that the federal government implements as part of the next stimulus package. But in the absence of federal action, our state government must act to shield business owners from lawsuits brought by customers or other third parties, unless they're able to prove that a business willfully failed to develop and implement a plan to reduce the risk of the virus. We are not saying that gross negligence and bad actors should not be held accountable. They absolutely should. The relief on this front should be temporary and targeted. We're asking for a temporary safe harbor protection to give employers some degree of assurance that if they follow all public health and guidelines, federal, state, and local, they won't face further financial hardship through unwarranted lawsuits. So we're not seeking blanket immunity here. We're not looking for protection for those bad actors. But this is something that the state could do in good faith that does not cost our budget anything, essentially free to the state to implement something like this that would give our small business owners that assurance. that they're not going to face that financial hardship. Many other states have done this, and we're just looking to achieve parity with some of those other states. So those are three major areas. Of course, we're doing a lot more than that. Feel free to visit our website where you can see our 2021 Renew Maryland document, which really details our plan and path to recovery, policies that we're pursuing on the road to recovery, and then also our 2021 legislative priorities, which echo that as well. And like our other speakers, happy to answer any questions that you all may have. Jerome, I guess I'm turning it back over to you.
Yes, thank you. And thank you for Dr. Gale, Dr. Stoddard as well. Appreciate all the great questions. As Ms. Duckman mentioned, we do have some great local chambers here in Montgomery County, and they are also heavily involved in all the issues that she mentioned. So we will be having them come and speak to this group in the very near future as well, most likely regarding the legislative session that will happen in January. So please be on the lookout for that. Before I jump to Dr. Gale, Dr. Stoddard with a question on Ms. Duckman, let me ask you one question that was posted while you were speaking, and it's with regards to the incentives that you mentioned for the air filtration systems. Do you know if it will be retroactive for a company that has already upgraded their system, or would it be forward-looking from the time the legislation may be passed?
So I have not seen bill language yet for it, but I know that in conversations that we have with the potential bill sponsor and the restaurant representatives from the Restaurant Association, looking at it retroactively is something that we would like to see be incorporated. I can't promise you because I haven't seen the language, but it's definitely an issue that has come up because we know how much investment has been made already by businesses, and we want to make sure that they're not excluded from being able to receive that benefit.
Agreed. Yes. And I think we would like that as well, hoping that everyone agrees to it. Thank you a lot for that answer. So Dr. Gale, Dr. Stoddard, we'll go back to our original, we have first three questions, and then we'll go to questions that may be in the chat. The first one is one that I think we've heard before, but just trying to get better clarification. The question is, can you provide database reasoning for the lack of broad guidelines addressing COVID-19 safety measures and guidelines that can be applied across the entire county economy and business sectors rather than inequitable industry-specific guidelines? And to me, this goes back to how the activities were broken up originally, I believe, by the state for phase 1, phase 2, phase 3, from lower risk to higher risk activities. The higher risk activities are still the ones that are not in play yet, and I believe that's the nexus of this question. The other part I'll read about it before I get your answer is, it feels like we are both making this more complicated than it should be and providing special treatment and opportunity for certain business sectors over safety for residents, such as restaurants and indoor dining, that can damage some businesses and may be contributing to our rise in local infection rate. So that's the total question, and I'll let you respond.
Well, as you pointed out, Jerome, the original declaration of what types of activities were permitted and allowed and how they were defined was made by the governor's office in terms of the road to reopening Maryland. And that was the guidebook that was used by many jurisdictions in terms of moving forward to assess their level of being able to be reopened. They were crafted at the time based upon the data that was available that suggested certain activities carry greater risk due to the capacity around those activities, the level of contact that individuals may experience, the closeness, the proximity, the duration of potential exposure. And so that is what, again, many folks, not only the state, but also it's consistent with when you look across the country. If you look at other jurisdictions, their playbooks of reopening and their phased reopening approaches actually use a lot of the same categories. And so that is what we follow in terms of how we've reopened, and we've continued to look at studies as they become available to determine if certain activities do actually carry a greater risk or they have lower risk. And when we've been presented with that information, we have tweaked our reopening provisions to make allowances for those types of activities to happen. And we've always and continue to look at other jurisdictions for best practices to get information to determine if certain activities carry less risk. I can think of back during the summer where we didn't have certain types of businesses open, but DC and Prince George's did. We were able to look at our contact tracing data as well as look at the experience that they had in their jurisdictions and make provisions for those businesses to reopen. Now, as it relates to where we stand right now, I would hope that it wouldn't take repeating the fact that we're looking at record levels of transmission right now, which is why we have not continued to move forward or pressed to move forward in terms of reopening other businesses, and in fact have put in a first layer of restrictions several weeks ago that limited capacity, as well as put in more restrictions to curb the volume and capacity, particularly of businesses and venues that had larger potential opportunities for folks to come into contact. And that was applied across the board. It was not focused on one particular industry. It was applied across the board for all of the different industries that were open based upon where we stand in our phase 2 category. We continue to look at the contact tracing data, and in fact, that's part of the discussions we're having now to determine if and what steps need to be taken to be put into place to further stem the increase in numbers and get us turned back around to where we do see lower community transmission levels, where we would feel comfortable being able to move forward and proceeding to a phase 3 that would make greater provisions for across the board types of businesses to be open.
Sorry. Thank you, Dr. Gales, for that great answer. And you mentioned some of the restrictions that we have right now in place and ones that may be upcoming in the future. And I know that indoor dining is on that list. I don't think it's a secret that it's on the list. It's just one of the activities that seems to pop up in every report and survey that you get. The question
I would add just to Jerome, one other thing is remembering back to also what businesses were deemed essential businesses versus non-essential businesses. And how that was categorized at a state and federal level. That has had a significant impact as well in terms of how some people may view some businesses may seem to be getting preferential treatment versus others. Those determinations weren't made by us. Again, those were definitions that have been used across the country and have been used at the state level as well in terms of reopening.
True, very true. Good clarification on that one. As the indoor dining restriction looms over us, so to speak, there's a question that we got today that says, is outdoor dining in a heated tent really that much safer than indoor dining? We see the county and state scaling back indoor eating at the same time, we see the push for outdoor dining with tents and heaters. Is there any science or opinions that you have on the contrast and safety for indoor versus outdoor dining? You or Dr. Stoddard?
I can start. Actually, CDC just released a report yesterday. It was sort of like a spot report that they do periodically that showed that there was a transmission that occurred at 21 feet in an indoor dining location where the person who ended up getting COVID was there for 5 minutes. And they traced it based on the sequencing of the virus in question to that exposure. 21 feet away, for a 5-minute exposure, and they were infected by the person who was eating casually with friends. And so, we've seen anecdotal support of this consistently. Indoor spaces, because of the ventilation issues that we have, and this is why I think the efforts from the chamber to work to get legislation to improve ventilation will be a big step in making indoor spaces safer as they're implemented. We've issued countywide guidance on in ventilation and filtration that aligns, I think, pretty closely with that effort. Outdoor spaces are substantially more ventilated, and that's why we see less risk of exposure in those spaces. They're not perfect. If you have large numbers of people in outdoor spaces, you can have exposures, but they are substantially better than indoor spaces in terms of their risk of transmission. And so we definitely, where we can, encourage things to be done outdoors and have subsidized those efforts through the reopening grant and other efforts to try and make more spaces outdoors. That said, we've seen in other places, and something we're paying a lot of attention to is the more you make an outdoor space look like an indoor space, the more you start to inherit the characteristics of an indoor space. So, you know, we've seen places where people have made tents out of, not in Montgomery County, but in other places, out of wood and other materials that look a lot more like sidewalk buildings than they do outdoor spaces. The more characteristics of a sidewalk building you have, the less benefits you get from actually being outdoors. And that's why even in the ventilation and filtration guidelines, we say if you're an indoor space and you can figure out a way to open up a door or open up a window, those things make a difference too. So for sure.
Wow, good answer. And I do know that here in Montgomery County, originally our outdoor tents were one flap open, and now we've gone to two flaps being open for the ventilation of the area, which again, still important, and the heaters, again, still important. Thank you for that answer. Let me go to, this question is regarding our hotels. And we all know that they were one of the first to close, last to open, and they're still trying to use their space as much as possible. Can you clarify gathering allowances for hotels? 25-person total for all meeting event space, or one person per 200 square feet? And then the follow-up question to that is, what are the guidelines for banquet food service in a hotel?
So typically our guidelines are agnostic to the location and more tied to the activity being done there. So for example, if you rented out your conference room space for a religious event, they would follow the religious, they would follow the worship, religious worship activities guidelines. Right. Alternatively, if you were having a gathering of indeterminate type, you would follow the gathering rules. And so it's more tied to the activity being conducted in the space than it is the space itself, typically for most things that we do. If you were doing it, if you're using, there's probably other examples we could give where the capacity will shift in the space depending on the nature of the activity that you're doing in it. But there is not a specific set of guidelines that would govern every activity that would happen in a hotel conference space.
Okay, understood. And the question regarding the banquet food, we know that buffet style service is not allowed right now. The banquet food service, what are the guidelines? We were shaking our heads before you guys got on the call, so I'm not sure if that question can be answered or if it needs to be clarified a little further.
Well, I think obviously if you were operating as a food service provider, you would follow the food service guidelines as established underneath the executive order. And so that would, I think, like I said, the space is less important than it is the activity being done there. And so if you were hosting a banquet, you would have to meet the guidelines as set forth for a food service establishment. I believe is the way I would read it. Sylvia, you may have a different interpretation, but I believe that's how we would interpret it because it's based on the activity.
That's how I interpret it too.
All right.
That's how I interpreted 3.
Everybody's on the same page. I love it. This is the final pre-submitted question, and it's not actually one I want you to answer, but I need to read it and then say how we're going to address it. But the question was, I just listened to an interview with CDC Director Dr. Robert Redfield, who said that elementary schools are not a source of infection. We now have the data to show that schools can be open and operated safely. We find that when teachers get the virus, they did not get it at school, they get it from a spouse or in the community. Has Montgomery County looked at this data? If not, why not? And if so, when will we expect a policy change? And prior to the meeting beginning, we got some advice and guidance from our legal counsel, Sylvia, who you just heard from, who says that this question is a question that you guys typically answer this type in your biweekly MCPS call. And we were going to get that question answered over there because we don't deal with school issues here in this business forum. But I did want to make you aware of it. Sylvia said that meeting was open generally to anyone who wanted to attend. So we'll make sure that the invite gets over to those who would be interested in talking or hearing more about schools, where it's going, and how we look for the future.
Jerome, I would, and we're happy to answer that question in another setting, but I would actually like to address that in a general perspective. We look at a lot of factors when we provide guidance. So we scour the literature, we look at best practices. When studies and information come out, we do acknowledge them, we do study them. We don't take them as a grain of salt, however. We look at, we don't just take one study as one data point. We look at the literature to see if there's other things to corroborate it, and to find out what the take-home messages are in terms of implementation. And I think it's important to remind folks is that when we do see a study that comes out, or we do see comments by, one individual or another individual, is to make sure that we're looking at the total context, because on the surface, sometimes it can appear that, it is saying one thing, and sometimes it is. But we also make sure that we study the entire quote, we study the entire context, and we look at the guidelines that have been put forward. It's also extremely difficult in situations to be able to do direct comparisons. For example, we'll say, well, jurisdiction X or city X or country X is doing this. Why aren't we doing that? And it's important to take a look to see what else is going on and what's happening. For example, when we look to our European countries that have, for example, left certain things open, they've also closed a lot of other things down in terms of lockdowns. We haven't done that here. Or when we look at how we compare and stack up to other jurisdictions, for example, when we look at New York City or we look at California, their response has been different from how we've gone about it from a state level, in terms of the level of restrictions in the environment and the standards within which they have set. So I say all that to say that, yes, we constantly are on top of the literature and studies that they come out. In fact, we have a team that's dedicated to pulling those together and doing a weekly literature review. But we also make sure that we don't just react to one set of comments or one study. We do look at the bigger picture and how that applies to us as a local jurisdiction. And again, there's multiple examples where when we have received information that is legit, it's thorough, it's comprehensive, it makes sense, we have made adjustments to our policies and the recommendations that we've put forward that allow us to maintain the greatest benefit from a public health perspective, while still being able to move forward with those particular activities.
Wow, thank you. Good answer. Great response. I think that the audience is glad to hear that.
I'd also like to add just a thing, and this is a general comment too. We're making best judgments on data that is evolving constantly, and I think that's just the important thing to recognize too. And so, whether it relates to schools or businesses or what have you, we're seeing a massive global experiment being conducted right now in different ways in different countries. And across the board, we're trying to learn as much as we can from it. But Dr. Gales has sort of laid it out. We're often comparing apples and oranges, or sometimes even like grapefruits and, onions. Some things are way different. And so it's very, very difficult to make extrapolations in some cases, and it's easier to make them in others. And sometimes you're looking for, okay, this particular outcome held up over 2 or 3 different scenarios to make us more confident that it actually is a real phenomena, as opposed to, in a specific circumstance, this was safe or not safe. And it goes both ways. There have been places where I think there was one study that came out pretty earlier or a few months ago that said, oh, gator masks aren't safe. And we were asked, why weren't we, all of a sudden telling people that they couldn't wear gator masks? And a week or 2 weeks later or 3 weeks later, another study came out and said, oh, wait, it's actually not that the gator mask isn't safe. It's the material that the gator mask they tested wasn't safe. And so that's the kind of examples that we're trying to learn. I mean, in the case of schools, I think everyone wants to understand too that we still don't know everything about this virus. And I think that, we're finding out about long-term health outcomes that are different from just life or death. and we're trying to understand those too. And so this situation is incredibly complex, and we're reticent to make decisions that we can't unmake in 3 months. I think it's important.
Thank you for that. Definitely a tough situation. And again, even though we've all been in it now for almost 9 months, it's still a learning curve every single day. And you just can't say that enough. But I don't see any other questions. Oh, yes, I do. Here we go. Understand this isn't really on topic, but health question. If we're all masked, socially distanced, and washing our hands, is there still a risk of the flu or the common cold?
Yes.
But I think the key thing is we're gonna get collateral benefits for the activities that we're doing to prevent COVID, meaning influenza has not been as high this year in many places across the country because of the things around distancing and hand washing and face coverings that we are doing to protect from COVID. And so I think there's some applicable, there's going to be some collateral benefits for some of the activities that we're doing as well. So, but just like COVID, in spite of our best efforts, we're still seeing infections, which means we're doing it imperfectly, number one, and number two, face coverings, hand washing, and distancing are not a 100% protection from flu, COVID, colds, or anything else.
Yeah, so Dr. Gales, did you have anything to add to that, or was?
I mean, the answer is just yes. I mean, we still can see it, but these are good practices to have in place while we're dealing with COVID, but they're also good practices to just do anyway. And it's interesting. I wish we could probably do a pre and post survey of folks of how often did you wash your hands before COVID, or how often did you observe these practices? And hopefully by people doing it in the setting of COVID, as Dr. Stoddard mentioned, and has collateral benefits across the board, we hope that that type of behavior and that level of hygiene continues after we hopefully have moved past COVID-19.
Yes, absolutely. I think there's a question going around is, will we ever get back to handshakes again? And this may not ever be the same, but, I'll get you guys out of here on that question, but I don't see anything else in there, but let me stop and say thank you for you, Dr. Gales, you, Dr. Stoddard, for your time. We're used to all the great information that you provide, and you definitely don't disappoint. So thanks once again for joining this group. Ms. Duckman, thank you for joining us as well. We're glad to have you as a guest. Like I said, I thought the information you provided was valuable and still very applicable to this audience. And I think that we all learned a lot from our panelists today. So on behalf of County Executive Mark Elrick, we do want to thank everyone who watched us today and tuned in. Please stay tuned for our next town hall number 4, which will be on December the 18th at 3 p.m. And there will be information released prior to the event regarding the topics and situations we'll discuss. So until then, everyone take care and be safe.